Adventure travel is a thrilling pursuit, offering the promise of breathtaking views, adrenaline-pumping experiences, and the chance to push one's limits. Yet, with the exhilaration of climbing towering peaks or diving into the depths of the ocean, comes a host of health challenges that can turn a dream adventure into a nightmare if not adequately addressed. Understanding these health topics is crucial for any adventurer, as is being prepared with first aid knowledge and emergency response strategies. Climbing, whether it be a casual hike up a gentle slope or a rigorous ascent of a challenging mountain, presents unique health concerns. One of the most significant issues climbers face is altitude sickness, which occurs when ascending to high elevations too quickly. The symptoms can range from mild headaches and dizziness to severe nausea and confusion. As the air thins, the body struggles to acclimatize, and without proper preparation, climbers may find themselves in serious trouble. To mitigate these risks, it is essential to ascend gradually, allowing the body time to adjust. Staying hydrated and consuming a balanced diet rich in carbohydrates can also aid in acclimatization. In the event that altitude sickness strikes, knowing how to respond is vital. The first step is to descend to a lower altitude immediately. If symptoms persist, supplemental oxygen may be necessary, and in severe cases, medical intervention might be required. Carrying a portable oxygen tank can be a lifesaver for those venturing into high-altitude regions. Additionally, familiarizing oneself with medications such as acetazolamide can provide an extra layer of protection against altitude sickness. Another common issue for climbers is injuries related to falls or accidents. Sprains, fractures, and cuts can occur with alarming frequency in rugged terrains. A well-stocked first aid kit is essential for addressing these injuries. Essential items should include adhesive bandages, antiseptic wipes, gauze, splints, and pain relievers. Knowing how to properly assess and treat a sprain or fracture can make a significant difference in the outcome of an injury. For instance, the RICE method, rest, ice, compression, and elevation, can be effective for managing sprains. In cases of fractures, immobilizing the injured area and seeking immediate medical attention is critical. In addition to physical injuries, climbers must also be aware of the risks posed by changing weather conditions. Hypothermia and frostbite are real threats in cold environments, and understanding the signs is crucial. Hypothermia can set in when the body loses heat faster than it can produce it, leading to confusion, shivering, and eventually unconsciousness. To combat this, wearing layered clothing, keeping dry, and consuming warm fluids can help maintain body temperature. If someone shows signs of hypothermia, it is essential to wrap them in warm blankets and provide them with warm, non-alcoholic beverages. In severe cases, medical attention may be necessary. Frostbite, on the other hand, occurs when skin and underlying tissues freeze, typically affecting extremities like fingers and toes. The skin may become pale, hard, and numb. If frostbite is suspected, the affected area should be gradually warmed using body heat or warm, not hot water. Rubbing the frostbitten area is a mistake, as it can cause further damage. If the frostbite is severe, seeking medical help is imperative. While climbing poses its own set of health challenges, diving presents a different array of potential issues. One of the most significant concerns for divers is decompression sickness, often referred to as the bends. This condition occurs when a diver ascends too quickly, causing nitrogen bubbles to form in the bloodstream. Symptoms can include joint pain, dizziness, and in severe cases, paralysis or death. To prevent decompression sickness, divers must adhere to safety protocols, including gradual ascents and mandatory safety stops. Knowledge of dive tables or dive computers can help divers plan their ascents safely. In the event of decompression sickness, immediate action is required. The first step is to administer oxygen if available. The affected individual should be kept calm and still, as movement can exacerbate the condition. Emergency medical services should be contacted immediately, and if possible, the diver should be transported to a hyperbaric chamber for treatment. Another health issue that divers face is barotrauma, which occurs when pressure changes affect air-filled spaces in the body, such as the ears and sinuses. Symptoms can include severe pain, dizziness, and even hearing loss. To prevent barotrauma, divers should equalize their ears frequently during descent. If barotrauma does occur, the diver should ascend slowly and seek medical attention if symptoms persist. In both climbing and diving, the risk of marine life encounters cannot be overlooked. Climbers may encounter insects or animals that can cause allergic reactions or infections, while divers are at risk of stings from jellyfish or bites from sharks. Carrying an epinephrine autoinjector can be vital for those with known allergies, and understanding how to treat marine stings is essential. For instance, vinegar can be used to neutralize jellyfish stings, while minor cuts should be cleaned and monitored for signs of infection. Ultimately, adventure travel is about embracing the thrill of the unknown, but it must be approached with a comprehensive understanding of health risks and emergency preparedness. Knowledge of altitude sickness, injuries, weather-related issues, decompression sickness, and encounters with wildlife can make a world of difference. Carrying a well-equipped first aid kit and knowing how to respond to emergencies can turn a potentially dangerous situation into a manageable one. By prioritizing health and safety, adventurers can fully immerse themselves in the beauty of the great outdoors while minimizing the risks associated with climbing and diving. With the right preparation, the world is truly theirs to explore.